Okay, friends, welcome to, I think, yeah, welcome to NNBF Coffee Chats, and this is basically a discussion forum. Essentially, it is a Christian discussion forum, church based, but we also have lectures that are not just for the community but also for the society, for all our friends of other faith also join at times. And today is one such lecture because the days of fasting are upon us right now, even as Christians, and also for our Muslim friends also, and perhaps from other faith backgrounds, people also fast on certain days. So we thought it was a very good time to have a session on healthcare, on taking care of our health in this days of fasting. And it's really a great blessing to have Dr. Mathew, whom I would say God has brought in our connection in the last, last month or so. And truly, he's a wonderful person. And, if you get to know him personally, just a bit of introduction about Dr. Mathew before I give it hand over to him. The time for the lecture. Okay, now just to tell you all, please keep your mics on mute once again and let him speak for a length of time. Do not interrupt the speaker. We will have a Q&A session right after he finishes. Okay, so please kindly be patient till that time. So Dr. Mathew SP is he's MD medicine from Seth GS Medical College and KM Hospital Parel. Senior consultant physician. He's a senior consultant physician interested in whole person care, practicing at Ashok One Hospital, Mumbai. So we are really thankful to you, Dr. Mathew. In your hectic schedule, you have made time to teach the community, the society about how we can best take care of our health in this time, in the season of when religious days are on. So over to you. Sometimes we can all be very zealous, but it's important for us to know where we are at in our health, and age and health levels. So, okay, over to Dr. Mathew. Welcome, Doctor.
Hello, yeah. Hi, and welcome to each and every one of you for taking this time off on this weekday evening. And I want to thank each and every one of you for attending. Today's topic on which I'll be going to speak on is on the topic of fasting and your health. So I'll start by just sharing the screen. I will just share. I got a small presentation which will
Yeah.
go along with this talk. So I'm just sharing that, and I hope that all of you can have see this, what
Yes, we
is
can.
there. Yeah. So this talk basically is divided into three different parts. So the first part basically will be talking about how incredibly our bodies are designed. Because when we talk about fasting and our health, the first thing that comes to mind is what is the meaning of this fasting and what is the way in which it affects our health. Okay. So just to give an introduction, fasting has been used in therapeutic, cultural, and religious practices and traditions for thousands of years. And basically, the traditional description of fasting is described as an abstinence, or you don't take some or all foods or drinks for a set period of time. Now, to get into the medical aspect of it, I'll just spend some time in the physiological and medical aspect of it because that is important for us to understand what happens to your body when you fast. So, when fasting, the body experiences ketosis. I'll explain these terms and undergoes a metabolic switch in its fuel source from stored glycogen to fatty acids. So, what is it? Don't get confused. I'm just going to explain all this in very easy and layman terms for you to understand the physiological basis for what we are actually going to experience as a body when we do fasting. So basically, as you know, in our body, there are four types of biomacromolecules, what we call carbohydrates, proteins, lipids, and nucleic acids. So nucleic acids are basically found in the DNA of the cells, the DNA and the RNA. But the other biomacromolecules are the carbohydrates, proteins, and the fats. And these are the main types of the food components also that we consume. Now, you must have heard of the first law of thermodynamics, which says that energy can be transformed from one form to another, but it can neither be created nor destroyed. So, what does food give us? Food gives us energy. So basically, when we talk about the cellular metabolism, there is a lot of detail in cellular metabolism, which I don't want to get into details too much about. But if you look at this slide, what you can see is that proteins, carbohydrates, and fats, all these three things are the ones which basically go with. I'll just magnify the slide for you. So this is the part where the carbohydrates and proteins and fats are entering into our cells, and there is a breakdown of large macromolecules to simple subunits. And this is the stage one. And from there is a breakdown of the simple subunits to even simpler as units, basically, where, as you can see in the slide, there is something called as ATP and NADH, which is produced. And in the last stage of this slide, the complete oxidation of these acetyl coenzyme to H2O and carbon dioxide. So what happens is that this ATP molecule is the key to what we are going to see is getting affected in our body when we fast. Okay. So that is basic biology and physiology. So basically, simple explanation is that these larger macromolecules that we eat, whether it is fat or carbohydrates or proteins, are broken down into simple subunits. The carbohydrates mainly get converted into energy. Energy is stored in the carrier molecules in large amounts of ATP. What is ATP? ATP, will come to it. It's a miracle molecule which is found in every person's body. And ATP is what gives energy to all of us. And how ATP is formed in the body, there is a video here, but we may not get time to watch the entire video. But this shows the amazing way in which God has designed the micro machinery in our body to generate energy and to use that energy to create proteins for us. So I don't want to go into all the details of this, but basically you can see that proteins, the protons, are positively charged particles which drive very microscopic motors in the cells of our bodies to produce ATP. And this ATP is what is called as adenosine triphosphate, which gives energy to our cells. So if you can see in this slide, these molecules of ADP getting converted into ATP. So this is how wonderfully these molecules are being produced in our body from what we eat. And some uses of ATP in the cells, basically to build complex molecules such as sugar, proteins, nucleic acids, and fats, to generate electricity within the cells of the nervous system. So, because now the very fact that you're able to see me and hear me is because of the electrical signals that are passing from your ear to the brain and from your retina of your eyes to the brain. And each of these things require energy, which is produced by ATP. And to expand and contract the muscles of your body, you are able to move your fingers of your hands and you have to move your legs and your eyes. All of these require energy. And that is where ATP comes in. It was estimated that an average human being of 70 kilos hydrolyzes almost 68 kilograms of ATP in 24 hours. And you'll be surprised to know what is the cost of this ATP if you calculate it in terms of the monetary value or the money value of energy. Somebody did a calculation and it came to $1.4 million per day. That is a price that you would have to pay to get this energy produced in your body, but which God has designed to be produced in amazing and miraculous ways. So, as I said, glucose is central to energy consumption, and glucose gets converted to ATP. And ATP is the energy currency. It is like the rupee or the dollar, ATP. And it is used for various functions all over the body, including the transport of molecules across cell membranes, contraction of muscles, performance of mechanical work, synthetic reactions that help create hormones, cell membranes and other essential molecules, nerve impulse conduction, cell division and growth, various physiological functions. So now what happens is glucose after a meal. So when you eat something, for example, whether you eat rice or chapati or anything, it is converted into glucose. And fat is stored in adipose tissue in the form of triglycerides. Now, when you fast, the glucose in the body is utilized, and after the glucose is utilized, the triglycerides are broken down into fatty acids and glycerine to provide energy. The liver converts the fatty acids into ketone bodies, which provide the main energy source for many tissues, especially the brain. So, this is how energy is used in the human body. Basically, the glucose, and the secondary part is the fatty acids. So, this is very important to remember, especially when you're talking about fasting. And as we know, fasting has been part of the Indian culture for centuries, basically practiced for religious, spiritual, and health reasons. And when fasting is done correctly, it can offer multiple health benefits. It is also important to know that there are certain preparations to be done before you go into a fast. Now, coming to the types of fast that are usually we talk about, one is called as intermittent fasting, where you alternate between eating and fasting periods, such as the 16 hours of fasting and 8 hours eating. Then there is a dry fasting, which is observed in certain religious fasts like Navratri, Ramzan, or Karwa Chauth, where there is no food or water taken for a specified period. Then there is water fasting. That means some people just consume only water for an extended period. Then there is a partial fasting, basically avoiding certain foods such as grains or dairy, common in Ekadashi and other religious feasts. Or there is a calorie restriction fasting, which is also called as dieting, where there is a reduced calorie intake. Now, in all these things we talk about in this fasting, what is going to be reduced in the body is the glucose. And that is why it was important to understand that when glucose reduces in the body switches to the ketones and the fatty acids for the production or the requirement of energy, because the body has to perform certain actions. It has to survive, it has to think, it has to breathe, and all these things can require energy. So whether you fast or not, the body has to find a way to create energy. Now, there are certain other types of fasting which do not involve food, and those are also called as fasting. For example, in the present day and age, social media fasting also is very important. That means you do not consume any social media. For example, you do not go on WhatsApp, or you do not go on Instagram or various other things. These are also called as fasting, and they are also equally important for our physical and mental well being. Righteous fasting, some people do this type of fasting where they say that we will not commit any sin in that time. It is again a religious type of fasting. Then action fasting. This is something which is described in the Word of God in the Bible, where it says that the fasting that the Lord loves is the fasting where you share your bread with the hungry, clothe the naked, and help the helpless. So, this is also a very important type of fasting which I would encourage each and every one of us to try. Then there is another type of fasting called as realignment fasting. Basically, it is about drawing closer to God in prayer and aligning our lives with His purpose. Hence, fasting and prayer are mentioned together in the Word of God, for example, in Matthew 6:16 to 18. Then there is also medical fasting, which is done for certain medical conditions, which are again too diverse to talk about in today's presentation. Now, what are the benefits of fasting, you may ask? Now, the benefits of fasting are improved metabolism because it can enhance the insulin sensitivity and support weight management. Especially, you must have read in today's newspaper that India is going to become the world obesity capital. Fasting can also improve digestive health. It can give the digestive system a break and reduce bloating and improve the gut health. Detoxification. Fasting may help the body eliminate toxins and rejuvenate cells. Heart health. Studies suggest that it can lower cholesterol and blood pressure. And also, people report improved focus and mental alertness during fasting. So, these are some of the benefits of fasting. Jesus, who lived around 2000 years ago in the region of Israel, emphasized fasting in a way that is not for public recognition, but rather to deepen one's relationship with God. If you're considering fasting for spiritual reasons, it's important to combine it with prayer, charity, and obedience toward the word of God. So that is again important whenever we consider fasting, because fasting, if you're doing it to impress others, then the word of God says that type of fasting will not benefit you. Now, there is important thing to remember is that there are some possible side effects of fasting. One of the common side effects is dehydration, especially during dry fasting, leading to fatigue and dizziness. Low blood sugar can cause weakness, irritability, and headaches. Nutrient deficiency. Prolonged fasting without balanced nutrition may lead to deficiencies. And digestive issues. Bloating or constipation may occur when breaking the fast improperly. So, whenever you think of fasting, it's very important to prepare yourself from the point of view of your health. So, when you get ready for fasting, it's important to understand that you maintain your hydration. You ensure that you drink plenty of water prior to commencing the fast. You eat nutrient rich foods. Basically, you incorporate proteins, healthy fats, and complex carbohydrates into your meals, and you transition gradually to fasting. So, if, for example, you're going to fast for a week or 20 days, or some people even go for 40 days, it is important that you start preparing your body well in advance so that you will enjoy the benefits of fasting without any of the side effects. So, if you're going to fast for a week, then you should begin by decreasing your intake of heavy foods at least 2 to 3 days before the fast. It is basically a rule of around 30 to 40% of the period. So, for example, if you're fasting for 20 days, if you go at 30% of that, will come to around 6 days. So, 6 days before the intended period of fasting for 20 days, you should start decreasing your intake of heavy foods and consider trying shorter fasting periods before moving on to longer ones. So, suppose somebody tells you, okay, I'm going to fast for 40 days, but you haven't even fasted for a day. So, in such cases, it's always good for you to first start by fasting for a day. Fasting for basically a day means, in the sense, you can start by doing a liquid fast. That means you say that you have only liquids, don't have any solids, and then you can switch to just having only water for the day, and then slowly progress to a longer period of fasting. So, it's very important that when you're preparing for fasting, and especially if you're having some medical conditions, to check with your doctor also, because there are certain medications which you should not be taking if you're fasting. Another very important thing to do when you're preparing for fasting is to pay attention to your body. And if you experience any discomfort, it's important to break the fast safely. So that these are the things that I wanted to share about fasting. And now we can have some time for some questions or answers.
Okay, we can stop the